Hello everyone, welcome back to the channel. Today we are discussing about concept of pharmacokinetics metabolism. For more details, check out the link in the description below. Don't forget to like and subscribe for more updates. Previously, we are discussing about the absorption and distribution. The second part of pharmacokinetics is metabolism. So, what is metabolism or what is biotransformation? Biotransformation of drug is defined as the chemical conversion of one form to another. In that case, bio means biological system and transformation means conversion of drug one form to another form. So as we all know, whenever we take drug, the drug should be lipophilic in form. After the drug show its effect, the drug convert into hydrophilic form for excrete out from our body. All chemical substances that are not nutrients for the body and enter the body through ingestion, inhalation or absorption are called as xenobiotics. Greek word xenos mean foreign or exogenous compounds. Drugs are also xenobiotics or exogenous compounds which enter the body by virtue of their lipophilicity. The body is armed with the metabolic system which transforms the water insoluble lipophilic nonpolar drugs into polar and water soluble products that can be easily excreted by the kidneys and are poorly reabsorbed. The primary site for drug metabolism is liver. It is a very important MCQ. Others are kidney, intestine, lungs and plasma. So after showing pharmacological activity, drug should convert into water soluble products by metabolizing organs. What are the metabolizing organs? First is the liver and others are the intestine, kidney, lungs and plasma. Next is the consequences of biotransformation. It means in metabolism what the results are coming. First consequences is active drug to inactive metabolites. Most drugs and their active metabolites are rendered inactive or less active. Means by inactive form drug is easily excreted out. Example paracetamol, lidocaine. Second consequences active drug to active metabolite means parent drug. Parent drug means which are taking and active metabolite means metabolism of parent drug. These two forms together show their effects. For example, allopurinol, digitoxin. Last is the inactive drug to inactive metabolite. Some drugs are inactive whenever we taking. After metabolism, these drugs convert into active form. Example, levodopa to dopamine. These are the example of active metabolite. Parent drug is in the active form and metabolites are also in the active form. Morphine, diazepam, imipramine, codeine, losartan. These are the active drug and these metabolites are also in the active form. Active drug and active metabolite together show their pharmacological effect. These are the example of drugs that transform to more active compounds after metabolism. Prodrugs are the example of drugs which are in inactive form when take this drug. After metabolism, these drugs are converted into active form. So the example of prodrug is levodopa, enalapril, proguanil, fluorouracil and acyclovir. And these are the converted form. These are the active form after metabolism. For example, levodopa is converted into dopamine and dopamine is the active form of the drug. This dopamine is used in the Parkinsonism treatment as neurotransmitter. Next, metabolism is classified into two phases. Phase 1 metabolism reaction is also known as functionalization reaction or non-synthetic reaction. Example of phase 1 reaction are oxidation, reduction and hydrolytic reactions. Phase 2 metabolism reaction is also known as the conjugation or synthetic reactions. These are the example of phase 2 metabolism reaction. Glucuronide conjugation, acetylation, methylation, sulfate conjugation, glycine conjugation, glutathione conjugation and last is the nucleotide synthesis. So at first, let's discuss about phase 1 reactions. What are the phase 1 metabolism reaction? So as I have earlier said that phase 1 metabolism reaction is also known as functionalization reaction. What is the primary objective of phase 1 reaction? Converts the parent drug to a more polar metabolite by introducing or unmasking a functional group. That's why these are known as the functionalization reaction. By these group, drugs are converted into water soluble group, increase in hydrophilicity, reduction in stability, and facilitation of conjugation means drugs are involved in the phase 2 metabolism reaction. Next is the phase 2 reaction. It is also called as the conjugation reaction. Conjugation means it is combined with another thing. So covalent linkage is formed between a functional group on the parent compound or phase 1 metabolite and an endogenous substrate such as glucuronic acid, sulfate, acetate or amino acid. It means drug is conjugated with any endogenous compound. As a result, hydrophilicity increases for excreted out. This is all about the basic introduction of phase 1 and phase 2 reaction. Now we have first pass metabolism. What is first pass metabolism or what is pre-systemic metabolism? This refers to metabolism of a drug during its passage from the site of absorption into the systemic circulation. All orally administered drugs are exposed to the drug metabolizing enzymes in the intestinal wall and liver, where they first reach through the portal vein. Pre-systemic metabolism in the gut and liver can be avoided by administering the drug through sublingual, transdermal, or parenteral routes. It means if drugs are orally administered, that case first pass metabolism is must. This is first pass metabolism of drugs. When we taking drug through the oral route and go to the GI tract, normally drug go to the vein, then heart, then move to the systemic circulation. But in that case, it doesn't happen. From GI tract, drug go to the liver and first they metabolite means before showing pharmacological effect. This is called pre-systemic metabolism. As a result, accurate dose is not reached and duration of action has been short. That's why if avoided first pass metabolism, then route of administration is IV, sublingual, transdermal, etc.